Hi, everyone. Welcome to the Kind Health Group YouTube and podcast channel. We are back, and we're here today with an awesome guest and friend of mine, April DeMaggio, who is a physician assistant who's been practicing medicine for almost 20 years and has a wealth of experience and knowledge. She also works for Kind Health Group. We love and adore her. It's so great to see you today, April. Hello.
Oh, thank you, Georgine. Hello. It's so great to see you too.
And of course, Annie is back with us. Hi, Annie.
Hi, guys. Super excited to be here.
Yeah, so we have lots to talk about today. We're going to talk about telemedicine and telehealth, and Annie's going to ask both April and I some questions about how it works, and just anything you want to ask, Annie, we're here. We're your doctors at your service.
So I'm just going to assume every telehealth appointment, everyone is going to assume that they have COVID. I'm just going to guess that. Is that what you're seeing?
Yeah, we're seeing that a lot, of course, because all of the anxiety that's out there. But what I can say that COVID has some pretty specific symptoms, you know, those being fever, shortness of breath, reduction in taste and smell sensation, headache, body aches. And if anyone is experiencing those symptoms, it's really important that they kind of check in with their healthcare provider at this point.
Yeah, and also there are lots of other conditions that can cause those symptoms as well. So we can diagnose those oftentimes through a telehealth visit also. We happen to be in the middle of allergy season, which can also mimic a lot of these COVID symptoms. And that can be very scary for people. The other thing too is that even though everyone's primary concern is about COVID, there are a lot of chronic health conditions out there that need to be addressed, and people are scared to go to their doctor or even call their doctor to talk about their issues with their heart, their chronic diabetes, their kidney conditions, their other lung issues, any chronic condition. We don't want you to ignore that right now, because if it goes ignored for too long, then it can become an emergent situation that needs a lot more attention than it normally would.
I have so many questions to begin with. So you talked about allergies, and I know that I've been reading a lot about pink eye and, eye symptoms are a factor. Are people, telehealth is a great way to sort of check in with your doctor and, say, my eye is pink, what's going on? Can you is it helpful to diagnose via FaceTime or through telehealth?
Yeah, it's really helpful. I used to say to patients when they would call me, over the phone and want to discuss like a rash that they had or something that kind of needed to be looked at, and they were wondering if I could treat them over the phone. And, a picture's worth 1,000 words. The fact that now we can virtually, check in a face-to-face visit with a patient, that's super helpful for me. Yeah.
I totally agree. And the other thing too is what I think patients don't necessarily appreciate or understand is that so much of what we do in medicine and in coming up with a diagnosis doesn't have to be in person. A lot of it is just observing and listening to your story and your symptoms and just being a really good listener. And it doesn't require a physical touch necessarily, except in some unique circumstances. But it's listening and observing, which is easy to do in a virtual FaceTime or video visit. Wouldn't you agree, April?
I absolutely agree. I think that's a big misconception out there for patients, is that we really need to touch their bodies to come up with our diagnosis. And so much of it, like you said, Georgine, is from the history. Usually I have about 80% of an idea of what's going on with my patient before I've even touched them. And that's really important. A lot of times it just confirms what I already know to be true.
Exactly. Well said.
And I would think one of the benefits are, if you are home with a fever and you are sick, be able to check in with your doctor daily. If you know a patient has a fever and it's getting worse, to be able to sort of hop into their bedroom on the phone and check in on them has to be such a, safe feeling for the patient.
I agree, Annie. With COVID especially, our goal is that we identify who these suspect cases are, and then we're able to isolate them immediately so we can limit that transmission to other patients that might be quite vulnerable. And then we can implement ways to support their health. And I know personally for me, to set up daily visits with a patient, whether they are identified as a high risk or vulnerable patient or not, is just so crucial, but not always, you know, is that available to patients when all we have is in office, visits to rely on.
So let's talk a little bit about fever, because I know that's one of the first symptoms, and I know just from being a mom, if someone asks me if my kid has a fever, I'll say yes, they have a fever. But I guess actually recording it daily, taking it, when is a fever to be something to be concerned with? What is the number? How long has it lasted? If you're taking, Tylenol or Advil, where do we talk about fever?
Well, if the temperature is 100.4 or greater, then that's something that we want to monitor pretty closely. Yeah, if it spikes higher than that and persists, which often fevers can, that can be a sign that that patient has developed either a secondary bacterial infection or something like in the instance of COVID, that inflammatory response, which can get really out of proportion, might have gotten much worse for a patient. We need to check in with them immediately.
Yeah, and it's also important to remember that fever is the body's normal response, immune response to fighting an infection. So fever by itself is not the issue. It's looking at the context of everything that's happening around the fever and what other symptoms you're having. Are you short of breath? Are you having any other issues? So, in the absence of COVID, I think people tend to worry when they have a fever that something terrible is happening. And now in this case, maybe that may be the case, but with COVID, but I think fever we have to remember that fever is a normal response to the body fighting infection, and a low grade fever or even a persistent low fever in the setting of, say, a common cold is not necessarily unusual. But again, it's just one piece of the equation. And so we can't fixate on any one symptom, and we really have to look at the whole picture, which is why it's important to reach out to your healthcare providers that can really kind of look at everything in context.
Right. I feel like there's a lot of information in the news, so I'm just going to go over some of the topics that have been kind of brought up lately, and you guys can speak the truth about them. Let's talk about pulse oxygen levels. A lot of people have been talking about that in regards to COVID. Thoughts?
Well, COVID, we have seen it create this, like I said earlier, out of proportion inflammatory response, and it can attack different systems in our body, not just our nose, our mouth, and our lungs, or respiratory system. It can attach itself to certain receptor sites, and that can create this full-blown inflammatory response. And if it is in the lungs, there are certain things that happen. There's this cascade of inflammatory events, and that can create a patient to become short of breath, difficulty breathing, and that can happen really quite suddenly. There can be quite a sudden change in the respiratory status of a patient. Pulse ox is a way for us to determine how much oxygen is in the blood. And although patients don't so much have that available to them when they're isolated at home, if they are feeling short of breath or coughing, they are instructed to call us right away if they have any difficulty breathing. But it's really about the inflammatory response that's happening.
I totally agree. I've had a lot of patients ask me about obtaining a pulse oximeter to measure their oxygen levels at home. And certainly, that is again a very individual decision based on your underlying conditions. If you have an underlying lung disease where you know what the numbers mean and you can adequately assess it, then I think that's certainly worthwhile. But it is something that has to be assessed again in conjunction with your healthcare provider, so that you can interpret that data, because there's a lot of data that comes back at you with that. So it's important.
Right. What about the difference between Tylenol versus Advil, or acetaminophen versus ibuprofen? And in the news a lot.
There's been a lot in the press about the potential for non-steroidal anti-inflammatory medicines like Advil, ibuprofen, Motrin, Aleve. It has been implicated that these could exacerbate COVID symptoms. However, the jury's really out on that. It's quite inconclusive if that's actually happening. So I think it's best to rule kind of on the air of caution and to maybe stick with Tylenol right now until we have more information.
I totally agree. And that's what I've been telling my patients as well, that, to err on the side of caution, Tylenol is probably the safest choice right now.
Yeah.
Okay, so people have been talking about stroke and the link between COVID and stroke. Strokes have been happening for people who maybe didn't present with symptoms of stroke. Can you talk a little bit about that, or family history, or blood thinners? What's the link between? What do you think the link between stroke and COVID is right now?
Well, we don't know a whole lot about the how and why that is happening, but we do know that what I talked about earlier, that inflammatory response, that it is inflaming some brain tissue in some patients. And if you are already kind of at risk, you have some type of vascular disease, we can see that this can happen severely, and some central nervous system symptoms can occur, or events like stroke, seizures, confusion.
Yeah, and this goes back to what we've been saying from the very beginning, that people with underlying health conditions have always been at much higher risk for COVID, because their bodies they're already compromised. And so when they get this massive inflammatory response, what you may have heard referred to in the press as the cytokine storm, it can really do a lot of damage to all organs.
Okay, there's been a little bit of talk about seniors, and maybe a symptom is memory loss or confusion. How do we sort of separate that from just feeling quarantined and, frustrated being home, especially if you're not near your loved ones or the seniors? How are you addressing that?
Well, I think it's important to say that if there is any change in a patient's mental status, that does need to be addressed by their healthcare provider pretty immediately. I think, one way that a lot of us younger, healthier individuals can help out is by really reaching out to neighbors, friends, family, which we know are vulnerable to some memory issues, or they've been confused in the past when they've been ill. Because confusion can obviously signal, like I said earlier, that their COVID infection may be getting more severe. So I think it's just really important if we all could kind of band together as a community and check in on those vulnerable patients. And if they do note a change in their confusion or memory, that they reach out to us, or the patient reaches out to us.
Such great advice, April.
So have you noticed with patients that may have been feeling anxious or depressed to begin with, that might have been on medications, are you seeing a rise in them needing more medication or needing to be in contact with you through telemedicine more often?
I think that a lot of patients are kind of vulnerable right now. All of us are, to having kind of a heightened sense of anxiety. There's a lot of health insecurity out there, financial insecurity. So I think it's normal to kind of feel that way. When anxiety and depression kind of impede us from the functioning of our daily life, that's when it can really become an issue. And if patients have a personal history of this, maybe they've been on medicine before, or even a family history, I think it's important that they check in with their provider. You know, medicine definitely isn't always the answer. There's so much that we can provide for a patient as far as support, you know, with some cognitive behavioral exercises they can do. Just we can offer them a lot of support. It doesn't always mean medicine. But I think if you're vulnerable, it is important to check in with your healthcare provider.
I agree. And I think a lot of patients often forget that that's something we're very trained and skilled in doing in primary care. They, you know, may think they need to see a therapist or a psychiatrist, and that well may be the case. But I mean, April, you know, probably 90% of what we do in primary care is also centered around mental health. So so we're quite skilled in dealing with those conditions, and those are things we can really address over telehealth and telemedicine visits quite easily. So it's important to reach out for that kind of help as well. And then also, I know a lot of mental health therapists are doing virtual visits. So there is a whole community of healthcare providers, not just physicians and PAs, but who are available and ready to help and really want to help everyone get through at this time. So it's really critical to reach out. Even if you had a therapist in the past that may not have done something like a virtual visit, they are all doing it right now. I can tell you that.
Yeah.
So I guess, when is the time to go to the hospital? Everyone is avoiding the hospital. When would you go? I mean, obviously, if there's been an accident, but what requires you to go to a hospital right now?
Well, I think simply stating that, you know, the emergency room is really important for emergent health concerns, not so much urgent health concerns or routine chronic care, but when there's an absolute urgency to a patient needing support, needing, you know, immediate imaging for whatever their issue is, then it's time to go to the emergency room. But that is a very good question, Annie, and one that we get asked a lot. And I think it's important, you know, and that's what's great about telemedicine is you can get in touch with a provider very quickly and be screened to see if that's what's necessary. But obviously, if there's worsening, as far as COVID goes, if there is difficulty breathing, if you're decompensating in any way with your respirations, confusion, we've talked about earlier, those are reasons. But we can help direct a patient when there's questions.
Absolutely. Good answer. Yes, definitely, April. Yeah, to reiterate again, shortness of breath, confusion, any like dramatic worsening of your symptoms would be reason to go, or something if you just simply can't manage at home and, you know, you've tried every other possible resource also. And again, from a telemedicine, telehealth perspective, that's something we can very easily assess over the phone. Usually, I know April will agree, if you can take one look at someone and say, you need to go to the emergency room.
Yeah. Yeah.
Which is good. I mean, it's kind of a first line screening. You need to know when to go, and if someone else tells you that knows what they're doing, that's the advice you need. What's the part, I guess, that you miss the human touch? What's the hardest part about practicing medicine without the human touch component?
I'm assuming you mean literally human touch. And there are, you know, some limitations. There are some times that an exam in, you know, person needs to happen. Those are the orthopedic exams. Say someone has an injury and there's a question that there might be a tear, a fracture. I really want to see those patients immediately. Abdominal pain. A lot of it, you know, I can get from the history and then direct the patient if I do need to do an exam. But I mean, that's a pretty important exam that I like to do in office. So there are like some limitations, you know.
Is it harder to start with a new patient that you might not have that developed history with through telemedicine?
I wouldn't say that it's harder whatsoever. It is going to be a longer visit that I will have with them because I really like to take my time, you know, to find out certain things that I wouldn't have known otherwise. Their social history, family history, their medical history can sometimes be lengthy. So that can take me more time. Is it harder? No. I love, the fact that I'm able to connect in this face-to-face way virtually, because it does help me kind of get to know their personality more. There's a lot of nonverbal cues out there, which I can pick up on. Sometimes the expression they have, or even the way that they're holding their body language, that really tells me a lot, that helps me or aids me in my diagnosis. And I can tell if they're understanding what I'm saying, or maybe they need more clarity, but they're kind of shy to ask me. I can tell by the way they're kind of looking at me if I need to spend some more time, or give them more clarity with whatever instruction it is I have for them.
I also think it provides a very unique opportunity to actually look inside of a patient's home and life and their social situation that we don't normally see. In fact, I find it's giving me a lot more information about people than my patients than I would normally get, because they've described a lot of their home environments and situations over the years, and but to have a visual of what they're talking about, what they're experiencing, what some of their barriers to care may be at home, I think provides so much more information than I would have gotten just being in the office with them. But I actually do miss just, I'm very connected to my patients physically. I like to hug them and let them know how much I care about them. So I miss that part, but that doesn't have anything to do with the clinical exam.
I know, I miss that part too.
I feel like I have to ask you both about testing. I mean, all people are talking about antibody testing obviously cannot happen virtually. So go for it. Talk to me about testing. What do we know?
Georgine, you're kind of the expert on this.
All right. Yeah, this is my favorite topic of the week. So I'll give you the 2-minute summary. So right now we have several different tests out there. The original test that we had a few weeks ago is called a PCR antigen test. That's the nasal and throat swab that detects if you have disease in your body currently. And it gets taken by a healthcare provider, but there was just a LabCorp just approved an at-home test that for doing that you can have a doctor order for you, and then you do it yourself and then mail it in. And it takes about, if you're doing that process, it probably takes about a couple weeks to get back, because you have to mail it in, you have to wait for the results, and then they send it back. That's the PCR test. And that is a very reliable test. It's been on the market now for about 6 or 7 weeks, maybe longer. And the other test that we're looking for, and that it was going to really be a game changer in terms of how we can begin to move forward and reopen our economy, is the antibody testing. And so antibody testing measures your body's immune response to a disease. And it does it there's 2 different kinds of antibodies that we measure when we do antibody testing. The IgG antibody looks at whether you've been exposed to a disease, whether you have had it in the past, or if you've been vaccinated. So that tells us your history, like of your exposure. The IgM antibody tells you if you currently have the disease right now in this moment in time, or if you're in the early stage of the disease. And you can have both potentially if you're kind of at the end of it and you still, you can have a little bit of IgM and start to develop some IgG. So the issue at hand now is that how do we get these antibody tests to everybody and get reliable tests to everyone? Right now, what happened about a month ago is the FDA fast-tracked approval for a lot of companies to get these rapid tests on the market. And so these are finger stick blood tests that take 15 minutes to get the results. And so you can see having that data in 15 minutes versus 3 to 2 weeks is completely, incredible. And it would really change give us a lot more data and help us make better decisions in a much more rapid fashion. So that's why these rapid turnaround 15-minute tests are so important. But what happened is the FDA put gave approval to a lot of companies to put these tests out, but they did it without any scientific oversight. So what has happened now is that the market has been flooded with a lot of these tests that may or may not be valid or reliable, and some of them are not valid or reliable at all. Some of them are total fakes, and it is actually impossible they all look the same, and this is the problem. And so it's impossible for any doctor really, unless you know exactly where it came from in the manufacturer, and frankly most of us don't. We're buying it from other resellers, to tell what's fake, what's real, what's not, and what's reliable. So we're waiting for larger lab companies like LabCorp and Quest to come out with tests that have gone through rigorous scientific trials, so we know that they're reliable and we can begin using those instead. I do know, however, Quest Lab has come out with a 24-hour antibody test that's a blood draw in the lab. So you have to go to the lab, the Quest Lab, and then they will draw an antibody test through the blood. And a lot of patients have been asking me about that. But my feeling is, if there isn't an urgent need to know to the level where you want to expose yourself to having to go to a Quest Lab where there are potentially sick people. So that's not a perfect test yet. What we want to see is really that 15-minute, quick finger stick turnaround. And so you see a lot of these pop-up clinics, and those are the tests they're offering right now. And a lot of them are getting shut down because we can't guarantee their quality or reliability. Sorry, that was a very long answer.
No, it's great though.
No, it's very informative. I feel like, there's a lot of information out there, and we need to kind of know what's right. What do you both think the positives from this for medicine will be afterwards from the pandemic?
Well, I think one of the big positives is that we are probably years ahead of using this type of technology. We all would have gotten used to it because it's so useful, with COVID. And that is such a plus. There are so many patients, that could use direct access to care, and they just don't have it available to them because either they're homebound, disabled. There's a lot of reasons why. So I think it's going to be such an incredible tool that we'll have in our tool belt, and that's going to advance the quality of healthcare. So I'm very excited about that. I think that another positive is that patients are going to be a lot more educated than what they were in the past with viruses in general. And, this could help in the upcoming flu seasons. Everybody's learning how to sanitize their areas, take care of others better. It's connecting us in our community a lot closer to each other. It's just a more caring, more compassionate vibe, and I think those are all huge positives.
I couldn't agree more. I have nothing left to say. You said it all so perfectly.
Thank you so much, April.
Thank you. Thank you both. It was so great seeing you and talking about this.
Thank you, April, for taking the time to be with us today. Stay safe and well. I love you both.
Thanks. You both too. Bye.